Have you ever walked out of a doctor's office with a new diagnosis, maybe for high blood pressure, and then realized you have a million questions you forgot to ask? It's a common and frustrating feeling. The doctor gives you the news, maybe hands you a prescription, and your mind just goes blank. You get home, and suddenly a wave of questions hits you. What do my numbers mean? What do I do now? Is this for the rest of my life? But having a good conversation with your doctor is one of the most powerful tools you have to manage your health. In this video, we're going to give you 3 vital questions to ask your doctor if you've just been diagnosed with high blood pressure. These questions will empower you to become an active, informed partner in your own care, ensuring you have a clear plan and a path forward. Good day and welcome back to Heart and Health. I'm Dr. Ed. As a cardiologist, I believe that your health journey is a partnership between you and your healthcare team. But a partnership only works when both sides are communicating effectively. High blood pressure is a serious condition, but it's also one of the most manageable when you have the right information. Unfortunately, many people just accept the diagnosis and a prescription without truly understanding what's happening in their body. If this sounds like something you're interested in, be sure to hit that subscribe button and like the video. Lack of clarity can lead to confusion and anxiety, and it can make sticking to a treatment plan much harder. The questions we're going to cover today are designed to give you that clarity. We'll start by making sure you understand your diagnosis, then we'll discuss the best way to monitor your progress, and finally, we'll talk about a crucial topic, understanding your medication. This is the information you need to feel confident and in control. Question number 1. What are my numbers, and what do they mean? The first and most important thing to do is to ask your doctor to break down your numbers for you. A blood pressure reading has 2 numbers, the top number and the bottom number. The top number is your systolic pressure, which measures the pressure in your arteries when your heart beats. The bottom number is your diastolic pressure, which measures the pressure when your heart rests between beats. You need to know what both of those numbers are and what they signify for your health. Don't just settle for a generic, it's a little high. Ask for the specific reading. For example, if your reading is 145 over 95, you can ask, what does 145 over 95 mean for my health? A good doctor will take the time to explain that 145 is elevated and puts you in the hypertensive range, and that the 95 indicates pressure is too high even when your heart is at rest. Understanding your numbers is the first step to truly managing your condition. It helps you set a baseline. You can then use this information to track your progress with your own blood pressure monitor at home. You should also ask about the ideal target range for you personally. While a general healthy reading is considered to be below 120 over 80, your doctor might set a different target based on your age, overall health, and any other medical conditions you may have, such as diabetes or kidney disease. For someone with other health issues, the goal might be slightly higher, and that's okay. The key is to know what your personal goal is and why. Knowledge is power. By understanding your specific numbers and targets, you can more effectively partner with your doctor and make informed decisions about your health. To truly grasp this, let's look at what's happening inside your body. High systolic pressure, that top number, is often a sign of stiffening arteries. Over time, high blood pressure can cause the walls of your arteries to become less flexible and more rigid, a process known as arteriosclerosis. This makes it harder for them to expand and contract with each heartbeat. The high diastolic pressure, the bottom number, indicates that your blood vessels are under constant strain even during your heart's resting phase. This means your cardiovascular system never gets a break. When both numbers are elevated, it's a clear sign that your entire circulatory system is under chronic stress. This is why knowing both numbers is so vital. They tell a more complete story about the health of your arteries and heart. Question number 2, what is my treatment plan and what are my options? This question is all about understanding the path forward. Your doctor will likely recommend a treatment plan, which may include lifestyle changes, medication, or a combination of both. You need to ask what that plan is and what other options are on the table. For example, if your blood pressure is only slightly elevated, your doctor might suggest a wait-and-see approach combined with immediate lifestyle changes. This could include things like reducing sodium intake, increasing physical activity, and losing a little weight. You should ask, is medication my only option, or can we try lifestyle changes first? If medication is prescribed, you should ask about your options. There are many different types of blood pressure medications, and they all work in different ways. Some of the most common are diuretics, which help your body get rid of excess sodium and water, and ACE inhibitors, which help relax your blood vessels. You should ask what type of medication is being prescribed and why that specific one was chosen for you. By asking about your options, you're helping your doctor tailor a plan that works for you. This question also opens the door to a broader conversation about holistic care. Don't be afraid to ask about the non-pharmaceutical side of the treatment. For example, what kind of exercise would be most effective for me? Or can you refer me to a nutritionist who specializes in heart health? These questions show that you're not just looking for a quick fix in a pill, but you are committed to a long-term solution. Question number 3. What are the potential side effects, and what should I do if they happen? This is arguably the most critical question when starting a new medication. Every medication has potential side effects, and knowing what to look out for can prevent unnecessary worry and ensure you're taking your medication safely. You should ask, what are the most common side effects of this medication, and what are the signs of a more serious reaction? For example, some common blood pressure medications can cause a persistent dry cough or dizziness. Knowing this beforehand will prevent you from panicking if you develop a cough a few weeks into your treatment. Additionally, you need to know what to do if you experience a side effect. You should ask, should I stop taking the medication or should I call your office? The answer is almost always to call your doctor's office before you stop taking your medication. Suddenly stopping a blood pressure medication can be dangerous and can cause a rapid spike in your blood pressure. It's also important to understand that not all side effects are the same. A mild cough might be manageable, but a severe allergic reaction, like swelling, would require immediate medical attention. By knowing the difference, you can respond appropriately and safely. This question is about making sure you are prepared for all outcomes, which is a key part of responsible self-care. Let's go a little deeper into this. Different classes of drugs have different side effect profiles. For instance, diuretics can sometimes cause increased urination or a loss of potassium, which may require a simple dietary adjustment or a supplement. Beta blockers can sometimes cause fatigue or cold hands and feet. Calcium channel blockers can lead to ankle swelling. When your doctor tells you the name of the medication, you can even ask, "Can you tell me about the side effects specific to this class of drug?" This level of detail shows you are a truly engaged patient and will help you better understand and manage your experience with the medication. It's about empowering yourself with knowledge so you can identify what's normal and when it's time to pick up the phone and talk to your doctor. These questions will turn a confusing diagnosis into a clear plan of action. The key is to be an active participant in your health. Don't be afraid to ask questions. Your doctor is there to help you, and asking the right questions shows that you are committed to your health. If you found this video helpful and want to learn more about managing high blood pressure, please consider subscribing to the channel. Hitting that red button helps us reach more people who need this vital information. Let me know in the comments below what questions you've asked your doctor that have helped you on your health journey. Your story could inspire someone else. For even more heart-healthy tips, be sure to check out our full playlist on heart health. Thank you so much for watching, and as always, take care of your heart.